When Becky came to see us, she's 54 years old. She doesn't feel 54, but she looks 54. And she's concerned about the way that she looks. She looks a little bit tired and a little bit older than she feels comfortable with.
What I'm hoping Dr. Newen can help me with on the change is that we'll be able to soften lines, bring up the brow again. This is getting pretty deep in here, so I think he's going to be doing some lifting and contouring there for me. Got a lot of lines across the top of my lip, and he's going to approach that in some manner and take care of these jowls that come about at the age of 50 plus. Well, I'm looking forward to accomplishing a refreshed and rejuvenated look.
We can help them with that. We can rejuvenate their face and make them look more youthful, more comfortable with the way they look, and more appropriate with how they feel.
I'm going to be going into surgery in just a little bit, so I'm looking forward to, I guess, just getting through the recuperation period. I know that I'll be in great hands in there, and it's nice to be able to feel that confidence as a patient.
Morning, Becky.
Good morning, Dr. Newen.
How are you?
Good. How are you?
Have you sit up for me?
Okay.
You're ready for surgery?
I'm ready.
Okay.
Ready for the recovery, the benefits.
Just look straight at my nose, okay? It's very common for us as plastic surgeons to do surgical marking so that it tells us how much we need to tighten on one side versus the other. A lot of people think that their face is perfectly symmetric, but in general, most of us plastic surgeons, when we look at the person's face, we can see pretty significant asymmetry. In general, one side will probably need more lifting than the other side, and we mark those areas specifically so that when we do the surgery, we want to create a face that has a balanced amount of tension on both sides. We want something youthful, but something that's very well balanced without exaggerating the asymmetry that existed before. On Becky, what we did first was to elevate her eyebrow. So we do that through a procedure called an endoscopic brow lift. That involves 3 small incisions on her scalp. And what we do is we free up the tissue of her forehead and allow the eyebrow to be elevated. And we elevate her eyebrow and put it into a good position to allow her eyes to look much, much more open and much, much more youthful. And then after that, we do the lower eyelid surgery. And in the lower eyelid surgery, what we're trying to achieve is to improve the contour of the lower eyelid. This is the more youthful contour of the cheek that you see in youthful people. They have a relatively fullness right here, and this hollowness is normal. And when you get older, the hollowness moves down, so that if you see on this side, the hollowness is down here. So what we're trying to do is to bring that back up to where it belongs, which is right underneath the globe of the eyes. After that is done, we perform the facelift surgery. And when I do the facelift surgery, I do it in 2 layers. After we elevate the skin to expose the tissue underneath, we also elevate and tighten the mass or the muscle layer underneath the skin layer to give it a more firm foundation, so that when we place the skin back down, the skin is not going to have to hold the tissue that's lax underneath. So it's like belt and suspender, so that the tissue underneath is firm and the skin is also has a good tension. What we use the camera for is to, when we do the forehead lift, is to identify the nerve structure and the muscle structure. When we do that procedure, we certainly don't want to damage any of the nerve structure that is present in the tissue. What we do want to do is to decrease the amount of muscle movement in their forehead to decrease the amount of wrinkles that they get after the surgery. More or less a surgical procedure to substitute the Botox injection. We took the excess fat from her neck area, which she doesn't need anymore anyway, and we used that fat for better use, which is to plump up her upper lips so that it will blend with the rest of her face. I'm very pleased with how everything turned out. So it was stressful, but it was good.
Okay, good. Thank you.
I guess we need to ask how you're feeling.
I'm feeling hungry.
That's a good sign.
That is a real good sign.
Yeah.
Very nice sign.
Yeah.
So your eyes are still like clear and blue, and it's not even bloodshot.
Excellent. Told you that they're the best.
Oh.
So was it more difficult than you thought or easier than you thought?
Easier. Yeah. Bye now. Thanks, Judy.
Yes, I can open the door.
Thank you.
When I saw Becky again about 10 days, she looks really, really good. And I think that if she just put a little bit of makeup on, it would be very difficult for anyone to know that she just had a very significant amount of surgery done.
I'm in my 5th week of healing right now, and I have minimal swelling left and a little bit of numbness out in this area. But I feel great. Things are going really well. And more and more people are curious as to just what the process is and how did it hurt. Most people are like, did it hurt? Didn't hurt. It doesn't hurt to recover. You do have a feeling of an awareness of the tightness because of the swelling. And so it just feels like maybe you have like a girdle around your head. But other than that, it's not a painful situation. Maybe the first day I took more than like an Aleve or an Advil that's over the counter. Other than that, things went really great, and I'm looking forward to the rest of the recuperation. I still feel really good about myself. I'm just impressed when I look in the mirror that I look so youthful. And I also am getting different responses from different ages of people when they look at me. And because we all have a presumed age when we look at somebody's face.
I think that the facelift operation is one of the most satisfying operations because it does seem to give the patient like a new lease on life. The face is the object that people see the most, and that is the thing that people evaluate you by. So I think it makes a huge difference for Becky. She looks youthful and she looks bubbly, and everything fits very well together, her personality and her new look. No one would say that she has a facelift done unless they know what she looked like before, or she chose to reveal to them that she had a facelift done.
It's such a wonderful thing to have an opportunity to do.
Becky looked great after her surgery, but we thought we can just whiten her smile just a little bit and to give her that little extra brightness and a little extra spark to her smile. And so we whitened her with Zoom. She looked great. She just had one treatment and it definitely brightened up her face and she looked fabulous.
It's wonderful that we can do something great for ourselves in the way of appearances and what the response is from other people. And when people tell you that not only did you have a great result in the surgery, but they were taking off decades, not just 5 or 10 years. When they're talking to me. So some people are even saying 20 years. So that's, for me, very incredible.